Okay, right. It's 4 o'clock, so I think we'd better get started. Thank you very much all for joining. For those of you who don't know me, my name's Jack Blanchard. I'm editor of Politico's London Playbook morning briefing. And thank you very much for joining what is the third in our series of virtual Playbook interviews on what is clearly the hottest day of the year. So thanks very much for staying in front of your computer and not sitting out in the sun for the next half an hour or so. If you want to ask a question, there's a Q&A box on your Zoom player. You can type questions in there. I will monitor them as we go. And if there are some good ones, I'll read them out to our guest. Now, our guest shouldn't need too much introduction. Jeremy Hunt was the longest serving cabinet minister of the last decade, the longest serving health secretary in the nation's history. And he came within, well, a few votes of defeating Boris Johnson in the Tory leadership contest last summer. He's now chairman of the House of Commons Health Committee, and I think it's fair to say has brought a welcome and needed air of expertise to that scrutiny role at an incredibly important time for the nation's public health. So, Jeremy, thank you so much for joining us today. We've got 40 minutes or so to talk through all things coronavirus and more. I want to look forward into the future. I want to look back at how things have gone so far. But I want to start off with where we are right now today. And you've been raising concerns this week that the infection rate in England is higher than the number of cases that are actually being picked up by the test and trace program. So I just wondered if you could start off by talking a little bit about that and whether you think that means that the reopening of the economy that we've seen this week is maybe happening too fast.
Well, good afternoon, Jack. Thank you for having me on the programme, and thank you to everyone who is sacrificing an ice cream in the garden or on the balcony to listen to us have this conversation. And I think you're starting with the most topical thing of all, which is, are we doing the right thing in coming out of national hibernation, as Boris described it? And what are the risks in the track and trace programme? And I think the first thing to say is that we have a track and trace program in place, which is based on what happens in South Korea, Taiwan, the countries that have been most successful in tackling coronavirus. And that is only possible because Matt Hancock had the courage to introduce that 100,000 tests a day target back at the beginning of April, publicly nail his banners to that mast, and that caused a big ramp up in testing capacity. And we wouldn't have been able to have the announcement we've had this week about the end of hibernation if that hadn't been put in place. So we have the right strategy in place. The problem we've got is that about 2/3 of the people who are getting coronavirus every day, according to the ONS, we don't actually know who they are, and we can't feed them into the test and trace, NHS test and trace. That's because the ONS does it by population sampling every week. They send out random samples and they make an estimate, which as of yesterday was about 2,500 new infections a day, which means that there's about 2/3 we don't know. And that's why what we have to do is to recognize that unlike Korea, Taiwan, we're introducing this test and trace at a period when there's quite high levels of transmission in the community. So the solution, which is a number of people are advocating, but including Tony Blair, William Hague, myself, is to move to mass community testing to really try and pick up those people who are catching it in the community, starting with health and care workers, because they're the most at risk. And that's where about 1/3 of all the infections are happening.
And why do you think that's happening? Why are we missing so many cases at the moment?
Well, because this is a horrible disease and it's spread very widely in the country. Luckily, the transmission rate is coming down, but places like Korea, Taiwan, they carried on tracking and tracing community cases right from the start. It's important to say a test is not a cure, but the reason you want to test is because you want to isolate anyone who's got it. So a test tells you who you need to take out of circulation effectively. And we're trying to introduce this system when there is a very high level of transmission in the community. So the only way we're going to find out these cases quickly, and you need to find them out quickly because you need to take people out of circulation before they've infected others. And you've got about 6 days from when someone shows symptoms before the person they've infected will have infected nearly all the other people they're going to infect. So there's a very tight window, which is why, as I say, I think this kind of mass testing is the way forward.
The test and trace figures we've seen today are not encouraging, are they? It seems to be moving in the wrong direction in terms of the proportion of people that are being reached, and indeed the proportion of their contacts that are being reached. How concerned are you to see that direction of travel?
Well, I think it is concerning. I mean, there are obviously going to be teething problems in any system, but I think we do have to recognize that you can't just take a system that was used in Korea and Taiwan and do it here without recognizing that we do have much higher levels of transmission here. And so we're going to have to be imaginative. And to give you an example, which I used yesterday in the House of Commons, Beijing has a population a third of the United Kingdom, but they have a testing capacity of 400,000 a day, so nearly double ours. And if we were testing at Beijing levels, we could test every single NHS frontline worker every week. If we added another 200,000 on top of that, we could add in every social care frontline worker as well. And you know, the thing we need to do more than anything is to make our hospitals and care homes safe, because there's a mountain of surgery that needs to be done. People have been put off having their operations, and they're not going to be able to be taken into hospital to be operated on until we have a higher degree of confidence that we don't have COVID in our hospitals.
Do you think ultimately the sort of mass national testing program that Tony Blair was advocating, where everybody's getting tested every week, could end up being the answer if we don't find the vaccine quickly?
If we don't find a vaccine quickly, we will have to go that route. But if we do find a vaccine, you know, most of the experts are saying that we won't have it manufactured in sufficient quantities for everyone to be able to have one, most likely before next spring. So the advantage of doing this now is it means that we're less likely to have another national lockdown that we're just coming out of, and we can keep on top of the virus by catching people who have it quickly and taking them out of circulation without having to close down whole cities and indeed whole regions and countries.
And how practical is it? I mean, do you get a sense of whether building up testing capacity to, you know, we're talking about hundreds of thousands, maybe millions of tests every day to do the sort of thing you're talking about? Is that plausible? Is that affordable? Is that something that, I mean, nobody's doing that at the moment, right?
Well, on money, it is clearly less expensive to do that than to have to lock down the economy again if we have another spike. And the evidence is now becoming clearer from parts of the world like Israel, parts of the United States, even Beijing, Seoul, that we are likely to have spikes throughout the rest of this year. So in cost terms, it's a no-brainer because it's much cheaper than closing down the economy. In terms of capacity, I think that Matt Hancock has shown actually the government is bloody good at ramping up capacity when the political will is there. And I think, in fact, if you spoke to most people in the NHS, there's a willingness to do this kind of thing, but we need that kind of political commitment that we had in April from Matt Hancock.
So the new rules that we've heard this week are very reliant on people self-policing themselves. I'm allowed to go and visit my mum now, but I'm not allowed to let her hug her granddaughter. Now, no one else is going to police that but ourselves. I can go to the pub with friends from next Saturday, but they all have to live in the same household as each other. Again, these aren't rules that anyone can realistically enforce. Anecdotally, I know people who are bending the rules already. Probably you know people who are. Certainly the Prime Minister knows one or two who have. Do you have concerns over whether what we heard announced this week is actually going to work?
Well, I think it can work. And I think that most people understand that, you know, whether you're a Boris supporter, a Conservative, or, you know, someone who is dyed-in-the-wool anti-Conservative, this isn't really a political issue. This is actually in our own self-interest. And so I think we have had a reasonably high degree of compliance so far. And I think it's perfectly sensible to do what we're doing this week. I think if you look at the combination of Boris's optimism and Chris Whitty and Patrick Vallence's caution, you end up in about the right place, which is, yes, we've got to get out of this. We've got to get back to normal life, but we need to do so with our eyes open.
How fearful are you of another big outbreak this winter when viruses tend to be more prevalent in the cold weather? People are spending far more time indoors again. I'm worried about it. Are you worried about it?
We've all got to worry about it. I mean, it's entirely possible. And indeed, we can see spikes coming back in different parts of the world, as we've just said. And that's why, if you remember, the testing capacity ramp up that we had in April, it was a superhuman effort. It took a month to get it from 10,000 tests a day, which is roughly what we were on at the beginning, to 100,000. What I'm talking about is, let's get it up to 400, 600, 800,000. That is going to take time. It is a huge, huge program. And I don't think, I love the idea of saliva tests. I love the idea of tests that you can deliver by someone's bedside that come back in 15 minutes. But I think we've learned from the app issue that you don't want to count on new technology. You want new technology to come in as a bonus. If it happens, fantastic. But we've got the swab test. We know you can get the results back in 24 hours. We're not quite there yet, but we know you can get it back in 24 hours. And that's what we need to focus our main effort on until we know that some of this other technology will deliver.
And how worried should we be by the disappearance of this app? We were initially promised it in the middle of May. It's clearly not going to surface this summer, and maybe, who knows, never, hopefully. How reliant were you on that working, do you think?
Well, I always felt from the beginning that we shouldn't rely on an app. It's like you may remember from last year, Jack, that I used to be an entrepreneur, and in fact, I was a technology entrepreneur. Yeah. So I'm very well aware of the excitement and thrill of a new technological development potentially solving all your problems. And so it is with a COVID app, because theoretically, there is nothing that can tell you with more accuracy who you've been near over the last 4 days than a mobile phone that's able to trace which mobile phones you've been near. But it is, I'm afraid, partly due to the intransigence of Apple, who weren't prepared to cooperate. We couldn't work out, and nowhere in the world's been able to work out how you get this thing to work unless the app is actually loaded up. So if it's just sitting in the background on your phone, it doesn't seem to work for Apple phones. And so, look, other countries have managed test and trace without these apps. They can help a bit at the margins, but we don't want to count on them.
But without one, things like contact tracing on public transport, for example, it's not possible, is it? It's the only way.
No, if you look at the SAGE minutes, they are very clear that you need to persuade about 80% of someone's contacts to isolate for test and trace to work. Most of the contacts people have with someone on the tube or the bus will be for less than 15 minutes within the 2 meter distance. And it can be less than 2 meters if you're wearing face masks and so on. So, we're not going to catch everyone, but you've got to catch the majority if you want to get the R rate down.
And just on public transport, face coverings are now mandatory. Would you like to see that extended to other indoor public settings?
Well, I think we've got to use our discretion on this kind of thing. What the evidence is that if you're within 2 meters of someone for more than 15 minutes, there is a high risk that you could catch COVID from them if they are someone who's carrying the virus. So anything that is a variation of that might justify wearing a face mask. I know in my local Tesco's, sometimes it's not possible to get 2 meters away from the other people doing the shopping because the aisles aren't that big. So, it's perfectly sensible to wear a face mask in a shop, even when it's not mandatory. So I think we should all be cautious and sensible about these things. I mean, the most cautious country in the world when it comes to personal hygiene is Japan. Mm-hmm. And they actually haven't had a real test and trace program. They've got very low testing rates. And no one can quite work out why it is they've got so few coronavirus infections and deaths, but it must be to do with their caution about personal hygiene.
Yeah, and a culture of mask wearing if in pandemics or when ill, right? Do you wear a mask when you go to the shops?
I haven't started yet, but you know, it's something one should think about.
I want to go back to the start of the outbreak at the start of this year. The government has taken a lot of stick for some of the decisions it made, not least from me. And I wanted to try and focus on some of the positives first. What do you think? What would you say have been the big successes in the way that Britain has tackled this crisis? Things that could have been disastrous, things we could have got wrong that actually the government got pretty much absolutely right and maybe isn't getting the credit for that it should do.
Well, I think the most obvious thing is that if you think back to March, we were looking at the most horrific scenes from hospitals in Lombardy, reports back that they didn't have enough intensive care beds, that doctors were having to play God and literally choose which patient got the bed and which patient effectively died. And we were 2 to 4 weeks behind Italy in the disease curve, probably actually only 2 weeks behind Italy in the disease curve now. So the NHS didn't fall over. We set up those Nightingale hospitals in record time. And I think that is a huge achievement, and I don't think we should underestimate that.
I remember writing at some point in March that Boris Johnson's government would ultimately be judged on whether the NHS was overwhelmed or not in the next few weeks, and it wasn't. But I think I was wrong now in retrospect to say that, because even though they achieved that primary goal, and it was, as you say, a great achievement, here we are with more deaths in the world than any other nation apart from the USA and Brazil. And that's despite a pretty strict lockdown, which has caused as yet untold economic damage to the country. It feels a bit like the worst of both worlds. So were we wrong to focus so much on, the performance of the NHS in those early days, maybe at a cost of thinking of some of the other things that were equally or even more important?
No, we weren't, because it's very important in a pandemic that your health system doesn't fall over, because if your health system falls over, even more people die, because people can't get into hospital. You can't treat people or isolate people who have coronavirus, who you need to get into hospital. And you have some of the horrific scenes that we saw, not just in northern Italy, but in hospitals in Wuhan, in China, and indeed, as we've seen in New York. So it's a very, very sensible priority in any pandemic to protect your health system. But with the benefit of hindsight, for sure, we would have done lots of things differently. We would have locked down much earlier, as Neil Ferguson himself has said. We would have used face masks much earlier than we did. We would have ramped up our testing capacity earlier than we did. And these aren't just mistakes that were made here. They were made by governments all over the world. President Macron has apologized to the people of France. They would have been made by Keir Starmer if he was prime minister. And indeed, the mistakes made by people like me when I was health secretary in terms of the preparations you make. And I think the thing we need to do is to get away from this blame culture of continually wanting to point fingers and actually understand what the mistakes were, and recognize that there may not necessarily be any individual who's responsible. I think it's pretty clear that Boris Johnson and Matt Hancock were following the advice that they were getting from SAGE. And it's pretty clear that we weren't the only country in the world that made these mistakes, and we just need to understand them because we're not through it at the moment, and make sure that we're better prepared next time.
I accept that to a point. It's very generous of you to call it with the benefit of hindsight. I was watching a clip of you on Newsnight on the 12th of March expressing deep alarm that Britain was not taking more measures on that very day, if not a few days before, to lock down. That wasn't hindsight. You were saying it at the time. Rory Stewart, one of your leadership rivals in the previous contest, was saying it. Plenty of other people were saying it. You said you were very concerned that external visits to care homes were still being allowed at that time. You could see it, what was happening. You were talking about mass gatherings not being cancelled. Why couldn't our top scientific advisors to the government see it? And why couldn't the minister see it at that time?
Well, I think this is obviously something that we will, I'm sure, look at in enormous detail. But for me, one of the most puzzling things is why SAGE in January and February, when it was modeling different responses to coronavirus, we can see that there was the famous imperial model that was, I think, released on the 15th of March. And it just modeled two extremes. It modeled extreme lockdown, which is what we actually ended up going into, and herd immunity, where you're trying to shield your elderly people from as much harm as you can. And it didn't model the way in the middle, which is the test and trace used in Korea, Taiwan, Singapore, Hong Kong, and China. They just didn't even model it. And I'm sure, with the benefit of hindsight, they would recognize that that was a mistake. But it is very difficult for ministers in that situation. If you're given options by scientists, you tend to want to choose the options. But I think that, you know, I wouldn't point the finger either at Chris Whitty or Patrick Vallance, because, you know, the truth is our mindset as a country, the mindset not just of this country, but the whole of Europe and the whole of America, was on pandemic flu. And you can see that by the fact that when we stopped community testing on March the 12th, I think it was, that was actually done quite deliberately. It was announced at the Downing Street press conference. There was no sort of sadness or shame about it. This is the next stage. We're moving from contain to delay, and we're stopping community testing, which is the flu playbook. And so we can see that, and the question we all have to ask ourselves, the searching question we all have to ask ourselves, including during the period that I was health secretary, nearly 6 years, is why were all our pandemic preparations focused on what you do with flu, where after a while there is no point in doing testing because it just spreads so fast. When we had SARS in 2003, MERS in 2014, both very different types of viruses that the countries that experienced those viruses actually really learned from them. And, you know, we all lionize South Korea. The South Korean government got massive stick in 2014 for the fact that it didn't ramp up testing quickly enough to deal with MERS. And they learned from that. And for some reason in the West, because we didn't really get affected by those diseases, we didn't.
And I mean, you made the point really well. I was looking at the UK Influenza Pandemic Preparedness Strategy 2011 last night, a document that
you know how to enjoy yourself.
Yeah. It was a great night in. But what's fascinating about it, as you say, it's the only published pandemic preparation paper that we've got. It's preparing for a different type of virus. But it's so clear from reading it that this is the playbook that we were following. It talks about limited evidence that restrictions on mass gatherings will have any significant effect, lack of evidence of any impact of internal travel restrictions, no plans to change the borders, perception that wearing a face mask might work but probably won't. You know, we followed this plan in the face of a different viral outbreak. I couldn't find any discussion of coronaviruses anywhere in the government looking back. The word was never mentioned in Parliament once before Matt Hancock made his statement in January this year. I mean, did it ever come across your desk that there might be another type of viral outbreak to the one that we were all worried about?
Well, I was responsible for something called Operation Cygnus in 2016, which was a big 3-day exercise for pandemic flu. And the results of that exercise were actually leaked to The Guardian a couple of months ago. So I reread them carefully. And what is absolutely fascinating if you read through it is there is not, first of all, the recommendations made to ministers were implemented, but there is not a single recommendation to increase the PPE stockpile. There isn't a single recommendation on testing at all. So, and we really did prepare thoroughly. We were ranked as the second best prepared healthcare system in the world by Johns Hopkins University because of our pandemic flu preparations. So, you know, I think this is the thing that we are going to have to think about. And I would say that there are two things we could do if we want to avoid this kind of mistake happening in the future. The first is, I think that if SAGE's advice to ministers had been public in January, February, in the way that the Bank of England's advice on interest rates is made public, then what they said would have effectively been peer reviewed by every scientist in the country. And we would have had enough scientists like Anthony Costello who would have come forward and saying, hey, you're missing what's happening in South Korea. And then I think the next time they gave advice, it would have been better. And I think that's one thing where, you know, we could definitely make an improvement in our system.
It's a neat answer, but I think it's a little optimistic. I remember the questions about being South Korea being put to the deputy CMO at those press conferences more than once. And I remember listening to her tell us that actually Britain knew best. Britain is an exemplar in its preparedness. And let's just see how South Korea does, she said. She said, well, they've had a very different type of outbreak, localized. It was a very, I don't want to pick on anybody, but it was a very complacent answer in retrospect. And I just wondered if you feel that maybe there's been a sense of Britain knowing best in this, at the start of this outbreak, and knowing better than other countries abroad that's been rather exposed by the reality.
Well, I'm a believer in British exceptionalism, Jack, because I think we're a fantastic country, and I'm incredibly proud of the contribution we made to the whole world. And I felt that as Foreign Secretary, it was an incredible privilege to represent our country. But I think our exceptionalism is when we are open to the best ideas from around the world. And I think that, you know, we should have paid more attention to what was happening in Asia at the start of this crisis. We may have a stronger science base overall in Britain and America, but they had the experience of dealing with MERS and SARS. And what was clear in January and February was that they were containing coronavirus at sort of 0.5%, 1% of the populations in those countries. Whereas all our projections were it was going to be 30, 40, 50, 60% of the population that was going to get it. And I think we should have just, instead of saying, well, they're wrong or they're going to be proved wrong, we might just have paused and said, actually, let's just properly understand the way they're approaching this, because they actually have had the experience of a coronavirus pandemic and we haven't.
And when you look back on your own time in office, is it with some regret now? I mean, obviously SARS was a long time before you were there, but the MERS outbreak in South Korea, which is to say, nearly brought down the government. They dealt with it so badly then, and obviously they learned some strong lessons. You know, obviously nobody in your department said, oh, maybe we should go over to South Korea and figure out what we would do if something like that happened here. Is that a matter of regret for you now?
Well, you know, Jack, the single thing I focused on most as health secretary was patient safety. And that was because I had to deal with mid-staffs as the first crisis during my period in office. And I concluded that the biggest cause of some of the terrible things that went wrong, like mid-staffs and Morecambe Bay, was a blame culture in medicine that meant that when something goes wrong, medicine is one of the few professions where people sometimes die. And when someone dies because of a mistake, that creates incredible pressure. And sometimes, instead of wanting to learn from what went wrong, the lawyers get involved, the NHS Trust gets involved, the CQC gets involved. People are terrified they're going to be struck off the medical registers. And the result is that people get defensive. And the most important thing you need when a baby dies because of a mistake is to learn why and make sure it never happens again. And that ends up being the one thing that doesn't happen. And so I spend a lot of time thinking about how you get rid of that blame culture. But I think we have the same thing magnified many times over when it comes to our response to a pandemic. People find it very difficult to admit any kind of mistake was made because lives have been at stake. But actually, we need to get away from that blame culture and actually really understand what it is that we did right, what it is we could have done better, and make sure we learn for next time.
The last question on this now, but we'll start to look to the future. But I mean, you are in a position to do that. You must have been thinking about this stuff non-stop for the last few months, watching what's happened, thinking about, you know, how you left the department, how well prepared or not prepared you left it. You must have an inkling in your mind as to some of the mistakes that were made back in the 2010s that left us pretty exposed now. Maybe you could share one or two thoughts on, you know, I'm not talking about blaming individuals, but why the system didn't prepare Britain for this type of pandemic.
Well, I think, you know, there's no doubt that the NHS and the social care system have been under tremendous financial pressure since the period of austerity caused by the financial crisis. And I was, you know, in the cabinet, David Cameron's cabinet in 2010. And I believe the decisions we took were right because we put the economy back on its feet. And if we hadn't done that, I wouldn't have been able to negotiate the 20 billion extra for the NHS in 2018, which was a huge battle to get. But I couldn't have even started that battle if the economy hadn't turned around. But that doesn't mean to say the NHS wasn't under financial pressure and the social care system wasn't under financial pressure. But I think the problems and the challenges we've had in tackling coronavirus don't relate directly to that pressure. They relate more to the fact that we didn't learn the lessons of SARS and MERS, which should have happened under my time as well. I fully accept that I have a share of responsibility for that.
Why did that not happen, do you think?
Well, as I say, I try to ask myself that question, and what should have been done better in the structures. And I do come back to the idea that transparency of scientific advice that would widen the gene pool of scientists giving advice to ministers and allow more. What I think we need to do is try and depoliticize the process of scientific advice, and also educate the public that sometimes scientists disagree, just as the economists giving advice on interest rates regularly disagree. And we need to avoid the groupthink that clearly existed. We need to find ways to challenge the groupthink that meant we thought we were all fine because we prepared for pandemic flu. And actually we needed to be thinking about pandemic SARS. So I think that's the kind of structural change which we urgently need to address.
Okay, all right. I want to take a couple of questions from our audience. Sean Walsh asks, why do you think there is a reluctance from the government to meet your and others' calls for regular and frequent testing? We've seen some resistance. I watched Matt Hancock in the Commons this week, didn't really embrace your idea with open arms. What's your assessment of why that is?
I think there is a nervousness about false positives. So there's a nervousness that if you test every doctor and nurse in a hospital, a certain percentage of the positive results back will be people who don't actually have coronavirus because the test is wrong, and therefore they'll be taken off duty when actually they're needed on the front line. And it's a very understandable concern. And I think the straightforward answer to that is, if that is the concern, then you do a second test. You do a confirmatory test before you ask someone to isolate who hasn't got symptoms. And you should be able to turn tests around within 24 hours. So these things can be done very quickly. I think that's one of the nervousnesses. But I do think that we will end up doing something like this. I can't see any other way that we're going to pick up all these new cases of coronavirus in the community that we don't actually know about.
Jordan Clark asks, what does the pandemic tell us about changes needed to the social care system? I know I've only got a few minutes, so don't give us chapter.
Well, look, this is absolutely right, and I said just now that I was proud to secure a 10-year plan for the NHS and a 5-year funding settlement. I failed to do it for the social care system. I tried to do them both at the same time, and I was told that the social care system had to come second, and then I was moved to being Foreign Secretary. And I do think that coronavirus has shown that we need to integrate the health and social care system fully, and we need to have proper funding for the social care system. And I'll just give you one very practical reason why. When the NHS is a bulk buyer of PPE, and when hospitals started running short of PPE, because the NHS has such purchasing power, they crowded out care homes from the market, and care homes found they just couldn't get PPE for love nor money. And that's just a practical reason why we need to integrate the two systems much more effectively. And I hope we do. And I'm hearing noises from the government that they get the case on that, but that is very, very urgent, unfinished business.
We have been hearing those noises from successive governments for about 20 years now, haven't we? So
you're right to be cautious on that, but I do think there is a willingness there.
Chris Whitty said this week he would be surprised if we're not still living with something that looks quite a lot like this situation a year from now. Do you share that assessment?
Well, Chris Whitty is a fine scientist, and so I'm a little bit nervous to be more optimistic than Chris. But if we can get a vaccine in wide circulation by the spring, then it seems to me that we should have a good chance of getting back to the old normal I suppose, to the new normal a bit sooner than that. So I hope that's not right, but we need to prepare ourselves for that possibility, I guess.
If things don't go well this winter and there is another big outbreak, which of course is possible, we've talked about that, do you think a second lockdown is even possible? Is it economically affordable, and is it socially going to be accepted a second time round, and especially on a very dark, rainy night in November when you can't even go to the park or anything else?
Well, I think we have to prepare for that as the kind of the ultimate blunderbuss weapon if there are no other alternatives, because we are a humane society, and I don't think we're ever going to accept the principle of herd immunity for a disease where there are 15% mortality rates for the over 70s who get it. So I think, in the end, if we needed to protect our older citizens, we would do that. But the more testing capacity, and I'm not going to be a crack record here, but the more testing capacity we have, the less likely it is we have to respond in that way.
And if it is a vaccine that saves us, how confident are you that Britain is in a good position in terms of manufacture and rollout of that swiftly?
Well, I think we have, fantastic scientists, and there's, some good there's a good vaccine candidate coming from Oxford, and there's a race going on at the moment. And I think the main advantage of it being a British vaccine that gets there first is not actually so much about national pride, although we'd all be thrilled. It's just that if it's discovered in your country, you're more likely to be able to manufacture it quickly for your own citizens. So that's why we wish the Oxford vaccine a fair wind. But I think there's the people like John Bell, who are real experts in this, seem reasonably confident. So I think that's encouraging.
And what's your gut instinct on how bad the economic damage is going to be of what's happened this year? Do you think we'll get a quick bounce back?
It's obviously not going to be a V-shaped recovery, and there are going to be big sectors like the travel and tourism sector that won't recover properly until we have a vaccine. But I think we should also remember that every recession that we've had has always felt worse in the middle of it. And at the end, we found that it's been slightly shorter than we thought it was going to be. I remember being in the cabinet when we were talking about the triple dip recession and how awful it was. And actually, the economy was recovering reasonably fast, even at that time, because of the lag in indicators. So I think we will get back to normal. I'm personally very hopeful that this time next year we'll be pretty much running at our normal economic capacity.
Do you have any sympathy with those? And I was reading one newspaper columnist this week telling us that the whole lockdown was actually unnecessary. We should have just shielded the elderly people and the unwell, and that this virus will burn itself out like other viruses have done in the past. And actually the whole thing was complete overreaction.
Well, I don't see the evidence from that. I mean, if you look at the Nordic experiment and the difference between what Sweden did and Norway did, Sweden is now doing a lot of soul searching for the fact that they didn't have a lockdown and they have much higher death rates. Now, these things are very complex. And I think one of the things that we've learned for people like you and me who are virus anoraks is that the death rates are caused sometimes by quite quirky differences in policy between different countries. It may be that one of the reasons for the higher death rate here has actually been the high spread in care homes. And it may be that the reason for the low death rate in Germany is not that they had test and trace right the way through, although that will have helped, but because they had better infection prevention and control in their care homes. For example, in Germany, care homes were not allowed to accept people from hospitals unless they could quarantine them for 2 weeks in the care home. If they couldn't quarantine them, they couldn't take patients from hospitals. So they had much stricter rules than we had. And that may have been one of the reasons that contributed to their death rate being so low.
And on that, some of the lack of preparation or the wrong decisions we made, you could understand them at the time. You could, the scientific advice was this, the ministers followed them. It doesn't look good in retrospect. The failure to protect care homes, to me, looks more inexcusable because it was just obvious to everyone from the very start that this was a highly infectious disease that is most deadly for elderly people. It was always going to happen, and yet people were shunted out of hospitals into care homes without testing, and visitors were allowed to keep visiting care homes until quite late into the pandemic. Can you see any reason for those poor decisions having been made?
Well, I think, you know, again, that is something that I'm sure we would do very differently now. And it's interesting, you look at Hong Kong, which has been in the news for a whole different set of reasons. But in Hong Kong, they not only have not had a single death in a care home, but they actually haven't had a single infection in a care home. And when you talk to people in Hong Kong, one of the reasons is because they had a very bad experience with SARS. They had a number of healthcare workers who died, and they sort of put a ring of steel around their care homes very early on in the crisis. And I think we knew that people in care homes were at risk early on. I think Sage was talking about this early on. People like Patrick Vallance were talking about this early on. But I don't understand why it is that we didn't do more earlier.
Yeah, okay. Looking to the future, there are cabinet reshuffle rumours kicking around Westminster once again. And your name is popping up frequently, Mr. Hunt, as an experienced wise hand who might be able to help government in the next phase of this. Does that interest you? Would you be up for another big job?
No, of course I'd be very honoured to be asked, but you know, I wasn't expecting to leave the cabinet last July, but when I did, I experienced something that William Hague described to me recently as the difference between your life being in black and white, which is what it's like when you're in frontline politics, and suddenly being in colour when you leave. And I've got 3 young kids, and they're just at an age where I want to spend more time with them, and I'm enjoying my role on the Health Select Committee. So I don't rule out at some time in the reasonably distant future going back onto the front line if anyone will have me, but right now this is the right place for me to be.
Okay, all right, well, that's just coming up to 45 minutes, so I'm going to wrap that up there. Thank you so much for joining us. Thank you everyone for tuning in and watching. We will have more of these events, I'm sure, through the summer and into the autumn, so keep reading Playbook and I'll let you know. Jeremy, thanks very much for coming on.
Thanks a lot, Jack.
Thanks. Bye-bye.